Hi, I'm Dr. Rifat Wahab. I'm a breast radiologist here at UC Health. Today I'll be discussing with you screening mammograms during the pandemic COVID-19. So let's first touch on why is your screening mammogram important? Well, the goal of a screening mammogram is to find a breast cancer before a man or a woman has symptoms such as a lump, pain, skin changes, or nipple discharge. A delay in obtaining your screening mammogram can result in a larger breast cancer, which may be more difficult to treat. Per the American College of Radiology, all women at the age of 40 should have an annual screening mammogram. Some women with an elevated risk of breast cancer may need to start screening sooner. In particular, our African American women are at risk for developing a breast cancer at a younger age. They are encouraged to have a conversation with their primary care provider by the age of 30 regarding their breast health. It should be noted that national organizations such as the U.S. Preventative Task Force do provide screening guidelines based on a more homogeneous Caucasian population, which puts our women of color at a disadvantage. So COVID-19 and screening mammography. During the pandemic, for the first time, UC Health has delayed screening mammograms from March 2020 to June 2020 to protect everyone from COVID-19 as we were trying to understand the virus. Over 2,000 breast imaging studies were delayed. But after understanding more about COVID-19 and taking extra precautions, it is safe for you to return to obtaining your screening mammogram. Here at UC Health, we're taking extra precautions to make sure your mammogram appointment is safe. All of our staff are required to wear masks and eye protection. We screen our team members prior to each shift for signs of COVID-19. We're limiting our mammography technologists to work in the same imaging suites. We have spaced out our patient appointments to decrease patient overlap. In addition, we are providing extra cleaning measures in our mammography imaging rooms, dressing rooms, and waiting areas. What are the steps that you can take to ensure your mammogram is safe? Please remember to wear a mask to your appointment. You will be screened for signs of COVID-19 prior to your mammogram. You'll be waiting in a private dressing room after changing, and there will be no overlap in a waiting area. Hand sanitizer is widely available throughout UC Health for your use during your appointment. These same procedures are also in place for our mobile van, where you can comfortably get your screening mammogram in your community. We're looking forward to seeing you at your screening mammogram appointment. Remember to bring your mask, but skip the deodorant. Thank you from your breast imaging team at UC Health.
Thanks so much, Dr. Wahab, for sharing such good information. You know, the pandemic has changed so much of what we do professionally as well as personally. Many of my patients will ask me about how long they can delay getting that screening mammogram. They're not noticing anything. How long can you think the average woman can wait if she's feeling well before she comes in to get her test?
I tell all my patients I would prefer you got it within a year with no delay. However, as we experienced during this pandemic, some unforeseen circumstances, we did delay mammograms for approximately 3 months. I would not delay any further than that, but try to be as close to a year as possible.
And what if you get that letter in the mail or you get that call that says, we'd like for you to come back for more imaging or perhaps even a biopsy? How safe is it to have a biopsy procedure in the imaging center?
It is very safe. Now that we have better understanding of the virus and what we need to do to protect our patients and ourselves, we have implemented extra precautions to make it safe for our patients to have that biopsy or additional pictures. We're again asking patients to wear face masks. We're protecting ourselves with protective equipment as well. We are spacing out our patient times, and we're limiting the number of technologists and physicians that the patients interact with. All of our equipment has always been sterile, and we always use a sterile technique, so it is safe for our patients to come in and have that breast biopsy.
You know, it's so important that we realize that cancer knows no COVID virus, and we must continue to identify cancer as early as possible. The earlier the detection, the better the outcome.
Yes.
So I think that's such a great message to send for everybody. You know, the pandemic has brought obviously chaos and confusion at times, but it's also had some positive silver linings to the cloud, so to speak. Can you comment either personally and professionally? Has the pandemic enriched your life professionally at all?
Yes. You know, as easy it is sometimes to focus on the negative, I think there's definitely a lot of positives that came back. We had a moment to come back and say, okay, we are a team. Let's put our heads together. How can we make breast imaging, breast health, and breast cancer detection safe for our patients? So just bringing together that team, sharing ideas, and also taking a moment to say, I'm grateful for all that we have. You know, I'm grateful for the wonderful colleagues, the great institution that we have to take care of our patients, and also grateful for our families and friends.
Well, one final comment. What do you think about the duration of this pandemic? I think every day I get asked, as probably you, how long is this going to last? What are your thoughts? I know you don't have a crystal ball, but do you have any feelings about this?
I really need a crystal ball, by the way. So looking back at history, looking at the Spanish flu, that was around for a while afterwards. So I'm thinking, you know, this probably is just the beginning, and we have a little bit of ways to go. But the good news is that we as humans are adaptable, and it has brought us together in different ways, and I think it will continue to bring us together in different ways. And sometimes it's hard to not see the positive, but I think that's what we need to do in this setting.
Yeah, very, very good. I thank you so much for sharing your expertise and your thoughts. If you enjoyed today's video, don't forget there's more to come. Every Friday in the months of October and November, we will be presenting another video that will hopefully depict how we handled breast cancer diagnosis and treatment during this COVID-19 pandemic. Next week, we will have Dr. Jamie Lewis from the Division of Surgical Oncology, who will tell us how surgical precautions and new procedures were developed. Her topic will be Cancer Wasn't Canceled, Improving Surgical Technique Despite the Healthcare Shutdown. If you have enjoyed today's presentation, please remember to use your social media to make others aware. Thanks again, and we look forward to seeing you next time.
Thank you.